Hello everyone! I hope all of your terms are wrapping up smoothly and that they have been successful. My research question is, do military veterans with PTSD experience more improvement of symptoms with standard treatment versus standard treatment in conjunction with equine-assisted therapy? The goal of this research would be to increase scientific support for equine-assisted therapeutic methods. Equine-assisted therapy is not yet considered to be an evidence-based practice thus far. This is because most projects like Arnon 2019 and Burton 2019 have been conducted over a short period of time, such as 8 weeks, and involved a small population of participants, around 16 people. The literature surrounding equine-assisted therapy all result in the justification of additional research, but they call for larger populations of participants over a longer amount of time. This research is important because equine-assisted therapy is already playing an active role in the counseling field and is growing in popularity. Additionally, studies such as MIMS 2016 have demonstrated that other types of animal-assisted therapies have shown up to an 82% improvement in symptoms, as well as reduced use of medication over a short period of time after treatment. As noted by Beats 2019, animal-assisted therapies are used in treating many mental health problems, including PTSD, anxiety, and behavioral disorders. Developing further scientific support for the efficacy of equine-assisted therapy will open the door for standardization of the practice that will result in consistency in the practitioner application and client care. My hypothesis for this research is that veterans with PTSD will experience more improvement of symptoms after completing standard treatment in conjunction with equine-assisted therapy as opposed to standard treatment alone. The null hypothesis would be that there was no statistically significant difference between the two treatment groups. This study would use an experimental design because one group would not receive a treatment, as well as the use of random sampling to select eligible participants, and random assignment to the treatment groups. Participants can be recruited by communicating with local veterans organizations such as the Department of Veterans Affairs and the VFW, as well as counseling centers who serve the veteran community. Participants would need to be a military veteran and have a current diagnosis of PTSD in order to be eligible. There will not be any controls for age, gender, race, ethnicity, or religion. Military personnel and veterans are made up of an extremely diverse population, and it's crucial that the research sample population mimic this as closely as possible. Exclusionary criteria includes individuals with current suicidal ideation, bipolar disorder, psychosis, and substance abuse and/or dependency. The instrument of assessment will be the PTSD checklist PCL5. This is a 20-item self-report questionnaire used by the Department of Veterans Affairs that can indicate a provisional PTSD diagnosis, as well as track changes in symptoms during and after treatment. It will be administered before treatment, halfway through treatment, at the end of treatment, and then 1 week, 1 month, 3 months, 6 months, and 1 year after treatment has ended. An independent sample t-test will be used to analyze the individual sets of data collected. This test was chosen because the results of the treatment groups are independent and do not relate to one another. An average of 22 veterans commit suicide a day. As I stated before, veterans are a diverse population, and not all current treatments for PTSD are suitable for every individual. This research can lead to the development of additional treatment options for veterans and further equip the counseling field to better serve those who once served us. Thank you.